probably the most important thing for the audience to be aware of is that prostate cancer comes in different flavors, different degrees and different severity. So you have some people that have a little bit of low-grade prostate cancer that some of us might even argue you shouldn't even think of it as cancer. It's just a little bit abnormal. And for those people, we usually do something called active surveillance. Once we do a biopsy and the pathologist looks at it under a microscope and says, this is a low-grade cancer, then especially if a man is 75 years old, he can just be followed, or 70 years old. He can just be followed carefully and evaluated. He get a biopsy to confirm that it's low grade, and then he can be observed. Then you have people that have what we call intermediate risk prostate cancer, which means that they're not so low that you want to do nothing, and they're not so high that your prognosis is much worse, but it's sort of in the middle. And those people need to be treated, but the treatment tends to be less aggressive.
Okay.
So you, in that case, you don't need any drugs. Many times you don't need any medication. You can have radiation or you can have surgery. If you have radiation, we only need to radiate the prostate, right? We don't need to radiate the lymph nodes that drain the prostate. We don't need to give you any hormone therapy or anything like that. For men who have high-risk prostate cancer, these are cancers that when the pathologist looks under the microscope, they go, oh, this is a Gleason score 8 or 9 or 10 on a 10 scale. Those people need to be treated. And sometimes, for example, if they have surgery, they need to have surgery, and then they might need to get radiation after the surgery. And the same thing is that if they don't have surgery, if they do radiation, we will usually combine the radiation with medication that makes the radiation work more effectively.